I have called this video 10 things to make communication with autistic people easier. You may have read my blog post on this, but I feel it's an important subject, so I decided to also make a video. So here we go. Here's my list. Number 1. Use clear, short sentences when giving information or instructions to someone with autism. Number 2. Give them time to answer you. They may take some time to process what you are saying and then create a response. Number 3. Don't get angry if they respond in a seemingly inappropriate way. They may not have learned some of the social niceties just yet, and often will not realise that they are appearing rude or hurtful. Number 4. For some autistic people, using pictures or diagrams to help get your point across can be helpful. This is something that really helps me. Number 5. If the person with autism is struggling to understand what you are saying, try to rephrase using words that are more descriptive. When working with autistic people, I have sometimes to rephrase things 2 or 3 times until I am confident they have understood. So experiment with different ways of expressing the same information. Number 6. Avoid overwhelming them with too much information and also your physical presence. That is, be aware that you may be standing too close and they may not like shaking hands or being patted on the back, etc. It's fine to ask them if it's okay to shake hands. Number 7. Please do not assume that they are not intelligent or knowledgeable. They may just have a different style of communication from you. Take time to really understand how the individual likes to be spoken to. Almost everyone will be different. Number 8. Do not force them to make eye contact. This will not feel comfortable. Once you have gained their trust, you can gently encourage them over time to make a little bit more eye contact. Number 9. Try to choose a quiet place to have your conversation. They may have trouble processing what you are saying and will be put off by too much background noise. This is something I struggle with, so this point is from personal experience. Number 10. If you sense they are beginning to feel uncomfortable or anxious, ask if they would like to sit in a quiet place for a while. Afterwards, you can resume your conversation. I have found this to be a very effective solution and often relieves the anxiety. So it can be very rewarding getting to understand how a particular autistic person likes to communicate. When I'm working as a tutor at the National Autistic Society, I have a different communication strategy for each of my students. My last piece of advice is, take the time to listen and understand. The rewards of more effective communication will be enormous for both you and the person with autism. Well, I hope you found this video useful.
So, I'm going to share with you a few things. I'm not your typical autistic. I have trouble communicating. It's more understanding what you're saying and why you're saying it. Don't get upset with me because I'm saying, what do you mean I don't need help? What do you mean there's something wrong with me? Tell me what's your reasoning for why I don't need help. Tell me why there's no reason for medications for my anxiety. Tell me, please. Give me information how I can understand it. 2. Don't assume I can give you all the facts. For example, the healthcare law clearly states a safe discharge plan. I'm not going to a safe discharge, and it's abuse and neglect what you're doing to me. Don't assume because I'm scripting the legal knowledge of the Office of Mental Legal Hygiene Law, NYCRR, Article 14, or the Department of Health Law, NYCRR, Article 10, or proper discharge or patient treatment, or don't tell me things that you don't want me to tell you. The next person. Don't tell me all the things you're informing me of. I don't need to know a lot of information. I take language literally, so don't get upset with me like my family does when they say, "Oh, you used to do this, you used to do that, then you stopped." I'm taking that literally, making it sound like it's a big change that, hey, what caused my behaviors? When Dad says, "Oh, what I do wrong," well, Dad, is there a reason for some of my cause of behaviors? No organization, no routine, everything I could put on the table or something that's important, it gets put in every other place. Dinner is always this time, that time, over there, that, eat at home, eat at this restaurant, eat at that restaurant. I can't even know if I'm coming and going there. Don't tell me to stop or no, and then keep talking. I see where my friend Julie says that has caused issues for me because I didn't realize my independent living center worker said stop, and I stopped right away. I never even noticed that. When my dad says stop, he gives me 5,000 reasons why I need to stop. Just stop is all I need. 2, or 3 rather, don't assume because I'm telling you all the facts of what my autism is, what my behaviors are, why I do in certain things. Don't assume I'm faking my issues. Because I'm not knowing what you think I'm faking or forging. Is it my arm flapping? Is it my rocking? My body jerking? My humming that's relatively new again? Is it my cons? Is it my body odor? Is it my appearance? Tell me what you think I'm faking. 5, don't assume my language of telling you about the weather, why the weather works a certain way, legal knowledge, doctor knowledge. Okay, hey, for example, radio vein. Radio vein and Omar vein. Okay? Don't assume I'm faking my problems. I know the difference. The radio vein is the inside, the radio vein is on the outside of my arm when my palm's facing up. The Omar vein is on the other side and facing up. The Omar vein is not the vein you use. You use the radio vein, or it just weighs an IV. The other arm, forget the veins unless you go into a part that's gonna hurt real bad. My hands you can use. I am sensitive to pain. Don't assume my screaming as being bad behavior or abusive or just trying to refuse care. As I'm not screaming for a reason. I can't tolerate the pain. Had nurses at Kemba Mercy who've caused me grief for screaming because I have sensory problem to pain. Don't tell me because I'm telling you My slap tear is at the bicipital tendon attachment. The glenoid, the slap tear is a superior glenoid labrum tear, meaning it's at the front part of the shoulder, and it's at the superior part, which means this front top part. And don't think I don't know medical terms when I tell you the glenoid is a cushioning between your humerus and your humerus head, also known as a ball of your the ball and socket part, and your acromion clavicle joint, AC joint. It cushions your shoulder from not rubbing on one another. However, it's different from your hip and knee and elbow. It not only cushions, it also helps stabilizes your joint. It also helps keep your shoulder in place. Other joints don't have that ability to keep it in place. So, when you have a slap tear, sometimes you can't throw overhead because your shoulder will just dislocate. And I'm already awake. And when you have that issue, and you throw overhand, your shoulder kind of like gives out and there's nothing there. It doesn't hurt unless it pops, slides, and catch. For me, at least. However, you can throw underhand, no problem. The other thing is, don't assume my ability to tell you, hey, I know what causes my language problem. Language is processed on the left-hand side of your brain. Left-hand side of the brain also affects your ability to understand language. It processes your language and it understands what other people are doing and affects your ability to respond. Nonverbal and verbal communication, both receptive, is processed there, and your ability to think and rationalize language and the response behaviorally and communicative-wise. Oh, wait. How the heck did I know that? Want to tell me more? Your weighted blanket is called deep pressure therapy. Lifesaver, guys. Lifesaver. It's a dopamine rush. It raises dopamine. It helps you feel more relaxed. For me. It helps with my Tourette's. It helps with my autism, anxiety, and sensory problems. Wait. Bear Hugs does the same thing. Putting pressure on my core of my body. Like what ECMC did when they restrained me. I didn't even remember what was going on around me. They put their hands on my hands and put my wrist on my body and put pressure on me. Somebody when I started relaxing, had shoulder squeeze. That helps me. That made me feel real good. It relaxed me. It helped me. And you know what? Didn't need medication to finish calming down. I was able to calm down myself. You know what? If I was thinking, my feet weren't being restrained at all. But yet, you know what? I had no ability to think. I was overreactive. That's the difference. Somebody who is aggressive thinks and purposely behaves. I am reactive. I don't have the ability to think. It's just on instinct. There's a difference there. Don't assume because I have language 1 minute that sounds like of a law professor, a medical doctor, or a meteorologist, and then the very next minute in the same conversation, I'm trying to ask you for water, and you are like, what are you saying? Or trying to ask you information of what you're trying to say to me. Or not understanding what you're asking me, and I'm trying to give you information that you're not understanding me. For example, homemakers didn't communicate very well with me last week. I had hell of a time communicating. Are you going to change my routine where it's tracking based? But you're going to, or are you going to take away the, are you going to allow me to track my routine? progress, or are you going to take away the hang on? Are you going to take away the routine step-by-step part and put in a tracking / routine board, paper and a folder? Or is it going to be, you're going to allow me to have the routine step-by-step task cards and the book you're talking about, so I can keep track of what I do and how I'm feeling, how easy it is, and all of that kind of stuff, and if I am doing my tasks and when I do them. And then it has the task cards of all the other steps I'm doing. I have a hard time communicating. I'm sorry. I'm smart, but language is my hard point. When I have language like that, like I was just explaining, it doesn't mean I don't know how I'm talking, don't know anything. But then I tell you, hey, our New York State Consolidation Law Article 9-B, the Social Service Law states clearly, for adult protective services rules and regulations, clearly states you had to provide protective services for an adult in need of self-neglect, unable to meet their own basic ADLs and things like that. You're not allowed to assume that there's nothing wrong with them, like an Erie County does, and you're supposed to provide assessments and all this other stuff. However, you can't know what I need help with without doing an assessment. You don't know what Andy's capable of, or what I need assistance in, or what supports I need for the skills I do know. You don't know my struggles. I know mine, and I'm trying the best I can. Because nobody's here to help me. Don't assume because I can tell you the scripting language of refusing services by you guys. Close your case. I'm voluntary service. I don't need to have services by you guys. I'm voluntary. You guys close my case. Get a court order to provide services to me. You don't want to do that? Well, get a court order. Then come see me. Bring your law enforcement buddy to serve me the involuntary court order of adult protective services under 9-B Title II. Oh, wait. Now I'm speaking legal jargon. Neglect is the inability to provide care for somebody for their basic needs in food, shelter, clean clothing, adequate medical supplies and medical needs, medications, social life, and ability to manage their own affairs safely. Self-neglect. When someone neglects their own basic needs due to physical or medical conditions, or mental conditions even. Passive neglect. Not knowing you're neglecting another person's care. Active neglect. You are knowingly acting in a way you are neglecting another person's care. Wait, how do I know this stuff? Simple question. You want to talk to me? Ask me questions. Ask me what my knowledge is on autism. Don't assume I'm faking my problems. Because you're going to find out very easily I'm not able to really understand what it is. Ask me questions. Put another example what autism looks like to me when spotting someone else. I would say they rock, arm flap, maybe toe walk. Maybe they, I don't know, communicate differently. I don't know. They have sensory problems. I don't know. They're smart. That I know. They're not dumb. They may have communication problems, social skill problems, but they're not dumb. They're not doing it on purpose. You want to know even more? Communicate with me. You see how smart I am. My gift of facts. Ask me questions about the weather. Ask me all these other questions. Now, come up with, hey, bring up a topic. Here's an idea. Ask me right now what the topic is of a news media coverage. Oh, I hear Donald Trump does this over in Afghanistan today. What do you know about that? I don't know anything. Didn't hear of it. What school did you graduate from? I didn't graduate. What school did you go to? Stanley Falk was my last school. Tell me what life was like in school with you. I miss it. Routine, structure. Did not miss how I was treated by some of the teachers, especially classmates. Some classmates. Not so much my classmates, but the schoolmates. Especially the kids on the bus. Had a lot of trouble on the bus where Annie didn't want to take the bus. And I didn't have any other way of other than communicating that. Didn't want to go. I miss it. When those kids were gone from school, it was way better. Wait, Dan O'Brien was a sexual offender. He was one of the people who caused a big, huge issue on the bus. Him and Ken Patton and a few other people beat up the bus driver, so they can smoke their cigarettes, marijuana, and did shoot up drugs. They brought razor blades that they put underneath their tongues. One of them brought a gun, Ken Patton. However, they didn't get any trouble. Wait, bringing a gun to school? Isn't that a felony? Isn't that a federal offense? Nobody takes me seriously because of my language problem. Wait, I lie. Really? And you wonder why I tell you so-and-so this, so-and-so that? To make it sound like I'm more believable? By the way, I really do have legal knowledge. I did consult many lawyers. Turned down many. Many turned down me. And he does have a friend named Julie who's helped me with this stuff. Who's a social worker. I did have a real name, Dr. Kim, help me. Wish they both were helping me still. My friend Julie, I think, has cancer. She's blocked me because I think she's going a really hard time right now. She was really nice. I know she's going to come back to me because Annie didn't do anything wrong. I did argue quite a bit with her on things that I was having trouble with, but the difference is between Julie, my friend, she has a better way of explaining something when I get upset and overwhelmed. She rephrases it a few times. She puts it in a story type of thing like my friend Doug does, but not exact. Julie, the homemakers person, doesn't help me explain it. Ask me questions, Julie. Next time you want, you see how my behaviors are? If you ask me how my behaviors are, and you're going to tell me right now, you're misunderstanding me, I'm misunderstanding you, ask me questions. Guide me through it. Don't allow me to communicate with you when I have trouble with it. Explain what you are doing to me. Ask questions to help me understand if I understood what you're asking me. Ask questions to help me help you understand if Andy's explaining it properly to you, for you to understand. It's not easy communicating. It's frustrating. It's stressful. It's an anxiety-based thing. And I struggle with that. It's like when you're talking to someone, it adds pressure. It's anxiety. It's exhausting. It's a lot. It's too much. and I really do really good at it. However, I'd rather talk about weather, hockey, science, math, or not so much math, but history, my facts, computers, that kind of stuff. I'm not a law student, not a medical doctor, not a weatherman, meteorologist. I didn't even graduate from high school. So how can Andy be a college professor 1 minute and a complete retard the next? It's because I have a language impairment. And the way I use my language is different than what's a normal conversation with someone. You talk to somebody normal, and from my understanding, you share information. You ask them about their day, they tell you about your day, you tell them, oh, did you like that? Did you do that? Okay. Well, what about so-and-so? Is that, I don't know. I'm just trying to explain to you what I've been told a few times. However, Andy don't know. I don't understand it. It sucks. I'm smart with all these facts. All my conversations are one-sided because I've an extreme hard time understanding you. So Andy just takes over all the conversation because it affects my behavior. And I hate being upset and frustrated because nobody can help me communicate. Nobody communicates effectively with me.